It is a hormonal disorder causing enlarged ovaries with small cysts on the outer edges. The cysts are basically eggs that fail to mature, and on ultrasound they look like black dots on the ovaries. Exact cause is unknown, but it thoughts of arise from imbalance in reproductive hormones. It creates issues in ovaries like eggs are not getting developed properly or eggs are not being released at all during ovulation. Excessive hair on face, chest, stomach, back, acne, mood swings, scalp hair loss, polycystic ovaries, infertility or reduced fertility, obesity, easy weight gain, absent or irregular menstrual period. Treatment will be combination of medicine and other supportive therapy. In medicine, we can use birth control pills to regulate menstrual cycle, oral hypoglycemic drugs to prevent diabetes, statins to decrease high cholesterol level, hormones to boost fertility, and cosmetic procedure to treat acne, hair loss, obesity. Maintenance of PCOS. When you are living with PCOS, you should maintain healthy lifestyle. Eating healthy diet, exercise regularly can help in maintaining proper physical and mental health and can help in reduce the risk of diabetes and improve the chances of getting pregnant.